What is going on, everybody? We are back with the Residual Earners Podcast, episode 14, going over insurance cost, rising insurance, and what we can do to lower it. And at the end of this video, we do have a solution for you. But I'm Jordan.
I'm Presley.
And we're just thrilled to be back with you guys. Obviously, this is a topic that most Americans feel the impact of. It's something that, in our opinion, has gotten a little bit out of hand and over time.
I would dare say a lot out of hand.
A lot out of hand. But like I said, stick around till the end of the video or the podcast because we do have a solution that we'll share with you. Also, guys, thank you for all the feedback we're getting. Subscribe to Residual Earners on YouTube. Leave us a comment. Let us know your thoughts. Let us know some topics that you would like to hear about. And, give us a little feedback. We want to hear from you. We want to give you what you want. We want to add value to your life. That's what we're about on the Residual Earners Podcast. And tell them, how's your week been? What's up? What's new?
Since we did our last one, and is that kind of mind-boggling? I say it every week, but 14 of these rascals. That's about 3.5 months we've been doing this.
And a lot has changed in 3.5 months. And hopefully y'all can see from the camera angles, we added 2 new cameras to the mix and really high quality stuff. Should be 4K, should be crisp. We added one last week and realized that, hey, one of the cameras looks really good, the other 2 don't. So, we're here to get better every single week, and I think we're doing it.
I think we've done some amazing things here.
Amazing.
When you look back to that first episode when we were all kind of a bluish green, we have come a long way. And then we sat on some stools for a long time, which were the most uncomfortable things I'd ever sat on.
That's true.
And now I could talk all day sitting here like this.
I could talk all day. And that was one thing when getting the new chairs. I was like, I want to be comfortable. And I think the conversation flows, and once we start getting more guests on, it's just an easier environment to talk, go back and forth, be comfortable, just like, we want it to be like we're sitting in a living room.
Amen. And, you said what I've been doing, my gosh, I had a tongue transplant and the body's rejecting it. You asked what I've been doing. Well, I went and gave some speeches.
Okay.
Talked to people about how they can be, do, and have more.
That's right. You spent a lot of time in the Northeast this past week.
I did. I was in Princeton, New Jersey last week. I was in Mechanicsburg, Pennsylvania last week, and I was in the great Commonwealth of Philadelphia.
Gotta love it.
Philadelphia, Pennsylvania, and had some great turnouts, a lot of fun. I think some people got some good stuff out of it, and I had a blast. I mean, it was fun doing. I enjoy getting in front of people. I enjoy trying to help people do better and improve their lives. And my gosh, it was a good time. Now, it's talking about good times. My good time wasn't near as good time as your good time.
I could agree with that. No, I'm fortunate to know some really great people that like to do fun things. And, buddy says, hey, I got a plane. Another buddy says, hey, I got a house. Let's go to Florida for 3 days and play a little golf at not much cost. And it's hard to say no to that. But I will say the Florida winds are a lot different than Dallas, Texas, and it was a windy trip, which affected the flight of the golf ball greatly.
And let's paint this picture. He goes and gets on a private jet and flies to Florida and stays in a guy's amazing house and plays 3 days of golf. I mean, I'm sorry you had to do that, but I guess somebody's got to suck it up.
The best part is it was 6 of us, and I won the pot at the end, so I beat everybody else, which is, what I get to enjoy over the next few weeks is a little trash talk. It's kind of my specialty on the golf course.
You're a stud muffin.
I don't know about that. We had a few good shots, though.
You and Scotty Scheffler both winning big, huh?
His bank account looks slightly different than mine after a win. So, but maybe one day, we're just going to keep swinging.
I'll throw this in. I was noticing that Scotty Scheffler, I loved it. He gave praise to Jesus for the win when he won and said that his identity wasn't golf, it was in the Lord. And I thought, man, that's standing up for what you really think.
Big family guy, about to have a kid soon. My question, though, was he said if his wife goes into labor, it doesn't matter when it is, he's out of there. If he rolls up on the 15th tee and gets the word that his wife's in labor, is he rolling out when he's up 3 on Sunday before winning the Masters, or do we finish the last 3 to 4 holes?
You know, I can't answer that, but you know, it helps that when the guy's probably worth $100 million, you know, it's not quite as big a deal as it would be for a rookie on the tour or something. So I don't know. We'd have to see how that one worked out.
It's a great question. So
it is. It is.
Well, let's get into the mix here. We obviously have, over the last few years, insurance costs they've gone through the roof. As a business owner, it's been something that when trying to hire new people, when offering, benefits to people, is something that has definitely affected the bottom line. So, we thought it'd be a great topic today since, we've all things business here. Kind of what are some solutions, go over kind of what's happened, and like I said earlier, the main thing is giving people solutions to this problem that so many people are dealing with.
Well, I'm going to give you some numbers, and I think they'll just kind of blow you out of the water. The 3 big industries that make the big bucks. Number one is big pharma. They're number one. Insurance companies, and then hospitals. We got 3 big industries sucking money out of our pockets.
Definitely.
And, get this, the top 5 pharmaceutical companies made $80 billion last year, with a B, billion. And here's what just blew me out of the water. That is a 104% increase from the previous year. So year over year, they increased over 100%, and we're wondering why cost goes up, why our drug costs are going up. Well, it's pretty obvious. And then, I looked at insurance companies, and United Healthcare being the biggest. United Healthcare, because I didn't want to bore us with a gazillion different numbers, but I thought this was worth it. They had revenue of $324 billion, Jordan. They had profit of $25 billion, again with a B. And get this, they were behind only Walmart, Amazon, Apple, and Exxon. So we've got Big Pharma making money from us. We've got United Healthcare making tons of money from us.
Definitely, and that's where the problem stems. That's just costing the American people, the business owners, a ton of extra dollars. It's putting healthcare out of reach for a lot of people that desperately need it, and it's sad that we've allowed it to get to this point where it's greatly affecting so many people.
It is. And then my last one, and hospitals aren't quite as big. There's a lot more of them and a lot more independence. But Kaiser posted $4.1 billion in net income last year. So you've got Big Pharma, $80 billion, United Healthcare, $25 billion, and Kaiser, $4.1 billion. All those billions, yet our premiums on our insurance just keep going up and up and up and up. And now we've got 40 million Americans without insurance because they can't afford it. I mean, you can just go on and on about that stuff, Jordan.
Definitely. And do you see anything changing what's going on right now in America?
No, you get a bunch of folks saying, well, let's do single payer, which is basically universal health care. And in theory, that sounds real good. But let me point out just a couple of facts. There's a whole list of them, but I won't go into all of those, but just a couple of them. One, when you have single payer, your choices go way down. Your wait times go way up. You don't get to pick who you go to, and you don't get to pick how fast you can have that surgery you need or whatever. The other thing is it would cost us as a country about, give or take, and this is from 2 or 3 different sources, about $3 trillion. Well, when you figure right now we're printing about $2 trillion that we don't have. I mean, understand our budget, we bring in so much, but we're spending $2 trillion more than we're bringing in, which means that's why our national debt, I think last time I looked, was at $36 trillion and going up rapidly, which means we've got to pay the interest on that debt. And now you can see that between interest on debt and entitlement programs, that's our whole budget right now.
Definitely, and I'm putting you on the spot here a little bit. Do you know why it would cost that $1 trillion?
Well, it would cost $3 trillion to go to single payer, because now everybody's got insurance, everybody's using insurance, and all those costs just add up. You know, when you've got a country of 330 billion people, you know,
so
330 million people.
The
rather.
extra expense comes from everyone without it now has it, because obviously it's a high expense right now, but there's so many Americans that do not have it.
Well, when I say higher expense, Americans
per person it would be less.
Yeah, Americans are paying. For the most part, most of them are paying their health care cost.
Correct.
Well, if you went to single payer and the government's paying a big chunk of it, that's where that extra $3 billion or $3 trillion to our budget would go. Which
we don't have the room for right now.
We don't. I mean, we can't pay for what we've got now, and we just keep adding. And understand this. I think a lot of the stuff that we're doing are good ideas here in our country, but it's just like you and I. I mean, I may have a good idea that I want to do to my house. I may want to add something to my house, or I may want to replace an air conditioning unit, or I may want to do a lot of things. But if my budget doesn't allow it, and I just don't have the money, I can either do it and go into debt or not do it. And what we're doing now as a country is we just keep coming up with a lot of them, like I said, are good ideas, but there's no money, so we just keep going further and further and further in debt. And, you know, one day you're going to pay the piper. I mean,
it's at some point it comes due.
Yeah, it's that's like you and I. We can live on credit cards for a while, but at some point in time, those credit cards, what you got to pay that monthly minimum ends up being more than what you bring in, and now you're in trouble. I mean, it's a trouble. And, you know, people say, why is health insurance going up? Well, administrative costs. I mean, it's unbelievable how much the administrative cost is. Hospitals are consolidating, which means there's less competition. That is huge. New technology. You know, I hurt my back a few months ago, and I had to have an MRI, and they had a new MRI machine at the hospital. And I forget how many $1,000s it was for them to just do an MRI on my back. Didn't take 20 minutes, yet it was just thousands of dollars. Now, you know, thank the Lord I had coverage, but it's unbelievable. And then obviously inflation hits all of us, but the inflation for healthcare, I mean, the cost of healthcare is going up more than the cost of inflation.
Yeah.
And it's not good. It's not good at all for us.
These are all just unbelievable facts, and I hope you know, TikTok Live, the podcast, y'all are understanding a lot of this, because these are great nuggets that he's throwing out that are giving kind of a background of why we are where we're at right now, which is a huge deal and a big problem. And I'll say this, and it's not really off topic, but a little bit. But that back injury was it was scary. I know it was scary for you. It was scary for us. Basically, pinched nerve in back, which was causing your legs to just give out without any notice. And maybe you can fill in a little more than that, because it was a little more in depth than that. But it was that was a crazy few months.
Well, I don't know how many people want to hear about my health because, you know, when I was 20 years old, I'd hear my aunt and uncles talk about health and, you know, what ailments they had. But I tweaked my back, wasn't very smart with it. I knew I tweaked it, but a buddy of mine called, wanted to play tennis the next day. So even though I know I got a tweaked back, we get out there and play some pretty hard tennis for an hour and a half. We came in, sat down in the house, ate a bite. And when I got up after about 45 minutes of sitting there, I mean, my back was so tight, I couldn't even move hardly. First time I'd ever experienced something like that. I mean, I'd had some back pain in my life, but nothing like that. And then I went out to one of our car dealerships, and I was walking from the main building out to the shop, and I got about, probably 10 yards from the shop. And next thing I know, I'm on my knees.
Yeah.
And without any warning, my legs just noodled on me. I mean, and that happened 3, 4, 5, I guess 5 times. And on the 5th time, I was walking in the house, and they just noodled on me, and I mean, I slammed to the ground. And it hit me then. I'm either going to tear an ACL, I'm going to smash my head and bust it wide open. I thought, I got to do something. So I had Jeannie call an ambulance, and off I went to the hospital. I'm one of those guys that thinks, I'm just going to get better. It's going to get better. It's going to get better. And, but for 2 or 3 months, I was actually on a walker, guys. And if you want to humble yourself, get on a walker.
Yeah. And seeing your dad, who's a very active individual, start dealing with that, going from, playing tennis, playing golf to working out every day, obviously, but on a walker, not able to get out of a chair. That was a crazy time, but all better now, which is awesome. And ballpark, what do you think that insurance cost on that whole deal was?
Well, I was in the emergency room at the hospital for just a few hours, and it was like, I forget, $14,800 or something. Yeah. And I was literally there just a few hours. They gave me a steroid shot and gave me some other medications, and I obviously gave me some doctors to talk to and some therapies and yada yada yada. But for literally, I was probably there 5 hours maybe, and it was almost $15,000, which is mind-boggling. This kind of plays into what we're talking about in that. Before then, I mean, I'm in the gym lifting weights, I'm playing tennis, I'm playing golf, and I mean, just boom, I need help. I mean, I had to get to the hospital. And then, as Jordan knows, about 5 months ago, his mom, my wife, had a slight stroke. And thank the Lord, she's 95% back now. But my point being is none of us know when something like that's going to happen.
Definitely.
We never know if we're going to have a car accident. We never know. I mean, stuff can just happen that's not in the plans. And that's when insurance or health sharing or whatever we have, that's when it really pays us, because 80% of Americans never meet their deductible each year. So in other words, they're just donating their money to the 20% that's using most of it.
Yeah.
And but we just never know when that's going to happen to us. So we need that, because you go in the hospital for something serious, I mean serious, and it can be hundreds of thousands of dollars.
Definitely.
Right now, Jordan, this is a crazy number to me, but there are 100 million Americans that have healthcare debt right now. 100 million Americans have healthcare debt. And if you look on people that file bankruptcy, the biggest cause of bankruptcy is when people get so much healthcare debt they just can't pay it.
No.
And they have to file bankruptcy. So this is serious stuff. And I mean, do I like sitting here talking about all this? Not really. But it's the real world, and my gosh, with healthcare costs soaring, I don't know what it'll be in the next 3 or 4 years.
Definitely, and the reason we're talking about this is because shortly we do have a solution for it. We're not just sitting here with bad news. We have good news that we're going to add value to your life here shortly. But I thought let's go over, like, as a business owner, the issues with the cost of insurance, because at our biggest point in the car lot, we had around 150 employees. And obviously, we are paying a portion of their healthcare cost, whether it's $500 to $1,000 a month of their healthcare cost. Me personally, my insurance was $2,700 a month. Now, this is PPO, low deductible. This is good stuff. This isn't, everybody's doesn't cost that. But as an owner of the business, and with 3 kids, that's what we did. But when you look at it, we're going to pay, and there were different plans for individuals, but certain team members that weren't making as much money, and they qualify for us to pay $500 a month, and they still cannot afford to get on insurance, which is crazy. But as a business owner as well, when you're looking at a big organization, $500 to $1,000 to paying all of my cost, you're talking hundreds of thousands of dollars a year off the bottom line because of insurance cost alone. And to go out and get talent, if you want to be a top tier business, nobody is coming over to your business without a good benefits plan. 401k, insurance, all the stuff that people want. Nobody's going to come work for you. So you have to be competitive, but to be competitive at the prices that are going on right now, I mean, it kills cash flow. It kills the bottom line. It can put you out of business because of how expensive things are.
Well, when I first started working as a coach and a teacher, they paid all of mine.
Yeah.
I mean, I didn't,
Do you have any idea what they were back then?
Oh,
I mean,
I don't remember.
Late
but
80s or early 80s when you started.
Early 80s, and I mean, it wasn't but like a couple of $100 a month, and they paid the whole deal, and they did that for several years. And then, we about passed out when they said, hey, y'all need to pay 25% of it. And then a couple of years later, it was y'all need to pay 50% of it. And I mean, it just kept going. And nowadays, like you said, think about you, Jordan, $2,700 a month.
A month.
Guys, for Americans, next to their mortgage or their rent, insurance is the next biggest item on their budget.
Yeah.
And I mean, who in the world, for somebody my age, would have thought that when I was younger? My gosh, it was kind of like a minor deal. Now that's bigger than your car payment. I mean, it's wild when you think about it.
It's not fun writing those checks because you don't feel like you're getting anything. There's nothing sexy in return. When you need it, a year, 2 years, 3 years down the road, it's awesome to have, obviously. But when you're making your car payment, you're driving that sucker every day. When you feel like you're getting something out of it, but insurance cost is not a fun bill to have to pay each month.
No, it's crazy to pay that. And like I said, 80% of Americans never meet their deductible. So it's almost like you're just driving down the road throwing $2,700 out every month.
Yeah.
Now,
and obviously, we realize other people's cost is not as high. We're not saying that everybody's is that high because it's not. But it's still a large cost for most Americans.
Yeah, well, my Blue Cross was $1,500, which, again, until I hurt my back, I can't tell you the last time I went to the hospital.
Definitely.
It's been years, but every month I sent them that $1,500. And my gosh, but there is an answer, Jordan.
Let's get into the answer, and this is your specialty. This is the nuts and bolts of this podcast today, is a solution for rising healthcare cost, and something you're very intertwined with, very knowledgeable about, have helped so many people better their financial situation while maintaining the same quality of healthcare.
Yeah, a lot of times it's even better. I will tell you that, guys, health sharing has been around since the early 80s, so 40 years, long time. And it's where people kind of band together and pool resources and help pay each other's medical bills. Now, the one thing about health sharing is this: you don't have to be perfectly healthy, but you got to be relatively healthy.
Definitely.
Now, I say that. There's a 36-month pre-existing. So with the company I'm with, if I had something crazy happen to me, as long as it's been 36 months since I had treatment or whatever for it, then it's wiped off. That doesn't matter anymore. But if I've had a heart attack, a stroke, a knee replacement, whatever in the last 36 months, that's called a pre-existing. So this is not for everybody, but for the relatively healthy people. And I went from paying $1,500 a month with Blue Cross to $426 with health sharing. And yours blows me out of the water, Jordan.
Definitely. And I told y'all, multiple times this podcast, I was paying around $2,700 for great insurance. But my recent quote that I'm switching to this month was $540-ish, and that's for me, my wife, and 3 kids. I mean, it's unbelievable, the difference, and to be able to use all of the same doctors in my network. It doesn't change.
No, and I always get the question, how can health sharing be so much cheaper? Great question. Well, let's think this through. We just talked about United. Their profit was $25 billion. Health sharing companies are nonprofit. You can't make money if you're in the health sharing business. And guys, I'm telling you that's the big difference maker. So I'll just give you just a thumbnail sketch here because we don't have time to go into details, but I'll give you a little bit. One, for better coverage and a lower deductible, mine went from $1,500 to $426. My deductible dropped down to $2,500 a month. And understand this is even a game changer and a money saver too. The deductible is per household. So like with Jordan, he's got 3 kids, himself and Nikki, that's 5 of them. The $2,500 deductible is cumulative with all 5. It's not per person, it's per household. So number one, you meet your deductible much, much quicker. Once you meet your deductible, it goes to a 90-10 split, which is great. I think with Blue Cross, mine was 80-20, but 90-10 split. So in other words, you only pay 10%. And then if you're ever, once you hit that 90-10 split, if you're ever out of pocket $5,000, then they start paying 100%. In other words, if something tragic happened in your life and, you had to go to the hospital and spend days, weeks, whatever, and you were ever out of pocket over $5,000, then they start paying 100% of it, which is phenomenal. The other thing is you don't have to, you can pick any doctor, any hospital, any clinic you want to. You're not limited. You don't have to look on a list and see if your doctor is on there. And then the other thing that we really love, and especially you'll really like this with kids, is you've got 24/7 telehealth. I mean, you can call or get on a Zoom with a doctor, and it's for part of the package. I mean, it doesn't cost you any more, and they can send you a prescription out to the local pharmacy or whatever if it's 2 a.m. and you don't want to bundle the kid up and get them to a doc in the box or something. So, my gosh, just lots and lots. And again, I'm not going to go into all the details here, but just understand it's phenomenal. I have been using it for 2 years now, and Jordan's is just now switching over.
Definitely. And, guys, if you are interested in this, leave a comment. We will reach out to you with more information. Obviously, we're not trying to sell anybody anything, but this is a product that does change people's lives. It puts a lot more money in your pocket, and it's definitely worth the conversation to see if it's something that's right for you. And you may go in a little more depth. Obviously, you had a major eye problem while on Impact. Kind of go through what that process was like, because obviously that was something that had to be taken care of, had to have a procedure. So kind of fill everybody in on how that went.
No, I'm happy to tell you. I tore a retina. Now, they say you tear your retina. I mean, I didn't do anything. It just happened. I don't really know why they say you tear your retina. Your eye just, something happens to it. And I had to have surgery. Well, and I'll be honest with you guys. I say that like I'm not honest all the time. I must be honest. This one statement.
I think people may question it after you said you beat me in basketball. So it's good that you need to say that.
You're too young for Alzheimer's to be sitting in, Jordo. I did beat you in basketball. But anyway, when I'm switching from insurance to health sharing, I did have some concern. I'm thinking, is this going to work? How's it going to work? Is this going to be good? I mean, so the first time I went to the doctor, I used to have my Blue Cross card that I'd walk in, hand the receptionist my Blue Cross card. Well, now I walk in and I hand them my health sharing card. And, I mean, it has worked seamlessly, just like it did with Blue Cross. I mean, I have been pleasantly surprised, and I've been to the doctor multiple times. I've been to the chiropractor. I've been to the eye doctor. I've been to the hospital, and my gosh, it works like a champ. And they've also got, if you're 65 or older, they've got a supplement, a supplemental policy that works phenomenally well. So
how does that work?
Well, you get Medicare A and B, and then if you want the drugs, the D part. So you get Medicare A, B, and D. I can't believe I can talk on.
I told y'all he's experienced in this.
Yeah, I'm getting old is what it really means. But anyway, Medicare A, B, and D, and then your supplemental is it'll pick up anything that they don't cover. So it's pretty crazy. And there's no pre-existing. Obviously, once you hit 65, the deductible's $1,000. Once you hit your deductible, they pay anything that Medicare doesn't pay. And obviously, we can get you all the details. You'd want to read all of it, but for a thumbnail sketch, that's pretty good.
That's awesome. No, it's just something like I've said, it can change somebody's life.
Yeah.
And especially it's affordable for people that cannot afford insurance at the moment. So, you could add it to something you have and take care of yourself, or just the money savings is another way that it honestly is mind blowing. And when I got my quote, I was thinking, I don't know if it works for somebody with a wife and 3 kids. There's 5 of us. That seems like a lot. I hear how good it is. I've seen it. It works for you. But I was mind blown when I got the quote back, and I was like, wow, that's real money in your pocket.
Well, that's a $24,000 a year savings.
Yeah.
24,000 plus, actually. On average, we save a family, on average, about $9,000 a year. And get this, it can be a single person, it can be 2 people, husband and wife or whatever, and then 1 child, be 3, but it's 3 plus. Once you hit 3 people, you pay the same amount whether you got a family of 3 or a family of 13. It's the same amount. So for you, it was a bigger savings because you did have 3 kids. I mean, y'all, 5 of y'all, but it's 1 person, 2 persons, or 3 plus. And so the bigger the family, the more the savings on that. Now, the one thing I do want to mention to you business owners is it can be a phenomenal savings to business. I mean, you can get a group on there as well. And for you folks that have businesses, I'm going to tell you right now that we've saved churches, we've saved small businesses, medium-sized businesses. We've saved people lots and lots and lots of money. I mean, when you consider what my savings was, what Jordan's savings was, and I'm not saying they're all that big, but I haven't talked to anybody that we didn't save them a pretty decent amount.
Definitely.
And it's for, in most cases, better coverage, which just blows my mind. In most cases, the deductible is much better. I mean, I could just go on and on. So
definitely. And guys, that's why we're here, to add value to your life. And I feel like, this episode really can add value to somebody's life. That's why, when we were talking earlier about what's our topic for this podcast, what do we want to do? And I was excited. I make a list, and, we just kind of, Presley makes a list as well, but we just kind of go through the topics, go back and forth. And I thought this was a great one to bring up. It can add so much value to somebody's life that, if one person makes the change, one person's happy and changes their life, it'll be well worth, putting out this podcast on this subject.
Well, yeah. And do you know anybody that if they could save $500 to $1,000 a month, it would change their life for the better? I'm going to say absolutely. We all know people.
We all know people.
Yeah, and I mean, you can also be a referral partner if you got interest there. But I'm just telling you that it's the real deal. It can save you some money. I'm a satisfied customer of 2 years, and I've used it many times.
Definitely. So yeah, if you're interested, like I said, leave us a comment. We'll reach out to you. We respond to every single comment, no matter what it is, and we will definitely reach out. But guys, we can't thank you enough for jumping on with us again. Number 14 of the Residual Earners podcast. Leave us a comment, subscribe to the channel. If you're listening on TikTok, or if you're listening on any of the podcast platforms, go to YouTube, look at Residual Earners, subscribe to us, turn on your notifications, the bell notification, so when we upload something. And we want the feedback. We want to hear what you guys have to say. We want to keep adding value to your life. We want to do a Q&A once we get enough subscribers. We want to do a Q&A with questions that we can leave feedback. There's so much stuff we can do. We're so excited about the growth of the channel already, and just can't thank everybody enough for supporting what we do here.
Yeah, and Grayson has a hockey game Wednesday. So
Grayson has a hockey game Wednesday. He had lacrosse this weekend. He's a busy kid.
Yeah, and Willa is the soccer star.
Soccer star. Still on the soccer field doing unbelievable. It'll be fun to see what Tay decides. But, Grayson's gotten into football as well, which Nikki will never allow that. But the last night, I threw him probably 100 passes. And before school this morning, we were throwing passes again in the front yard. So
I was throwing passes to him this weekend.
he said this morning, I said, dude, you got to start running routes and look over your shoulders. Oh, I did that with Poppy this weekend.
Yeah. He can catch it.
Over the shoulder, we're still working on, but he can definitely catch.
Yeah. Well, you can tell I'm a proud grandfather. I have to bring up the grandkids. They're amazing. My gosh, love them to death. I don't know if we got anything else for these folks on this episode of Residual Earners.
Residual Earners podcast.
Hey, I'll say this. Put in the comments what you want us to talk about. I mean, we will cover any topic within reason. We'll cover any topic out there.
Anything business.
Yeah.
That's what we're here for, guys. But thank you all. Love you guys. Thank you for all the support, and we can't wait to be back with you next week.
God bless.
Awesome, man. Love you.
Love you.